Welcome, everyone. I've got John Martine here. He was a certified rolfer in 1992 and completed his advanced training in 1997. And he is here today to share about his experience with working with nerves, vasculature, and just to get an update of what's going on with him right now and what he's passionate about. So welcome.
Welcome. Thank you.
So to start us off, I'd really love to know when you first got interested specifically with nerves and vasculature, what was your curiosity? What kind of drew you to that kind of experience in?
Well, I'd been studying with the Barral Institute, and this was probably starting over close to 20 years ago, and had done some of their work with the visceral manipulation curriculum. And a colleague of mine, who's since passed away, Don Hazen, had been exposed to the neurofascial approach by Barral through a class specifically for chiropractors, since he was a chiropractor. So this prompted a conversation and an inquiry into what is it that is holding or responsible for the limitations somebody may have in movement or posture. So we'd had a mechanical model historically from Dr. Rolfe that involved fascial adhesions as a primary response to repetitive use, accidents, injuries, psychosomatic or biopsychosocial pieces. Life impact on us will leave us at a place where our fascia is in relationship. And Don, through the exposure to Barral's neurovascular and neurofascial approach, started going to the deep other side. It was all nervous system driven. And the nervous system is driven by the body's protective mechanisms, which then the body uses kind of lower on the hierarchy, a muscle contraction to protect those important structures. And you end up with a fascial restriction that we were able to work with from a myofascial standpoint that is actually nervous system driven in terms of the hierarchy. So Don Hazen was kind of my initial foray in there, and I followed him around for a bit, assisting him, and then got interested in that pathway and went on to study directly with Barral's body of work. So that was kind of the initial inquiry, and it was an shifting of the explanatory model from just a mechanical piece to a neural fascial piece that kind of fleshed out the systems and the ideas a little bit more for me.
How did that change when you were working with clients as you started to integrate this aspect into the work?
Well, the part of what people understand and expect around structural integration is that it will be a direct approach that involves a certain amount of listening on the practitioner's standpoint, but it is definitely more of the practitioner putting an input into the body and then that making a mechanical change. And while we're listening, it was typically biased to, in my experience and how I delivered the work, biased to I had the agency and I was the agent of change. Although it was happening under my hands, there was an element of, in my background, or in my back of my head, I was facilitating something as opposed to making an invitation to the nervous system to make a change, which involved 20% of input and 80% of listening, as opposed to somewhere in between the opposite of that.
Yeah.
So it became easier on my body to sit and wait, although mentally it was quite an adjustment to not be as active, right? And thinking that I was the one that needed to be participating in this. So over time, I figured out I was necessary but not sufficient.
Mhm.
in terms of inviting change for my with my clients, and it became more of a with than an on in terms of how I was working, which put so much relief through my whole system, and I think it was easier for clients to receive as well.
Mhm.
So over time, there has been a big shift in terms of that kind of relationship. And now I feel it's even more relevant given the state of people's nervous systems and the pace at which the world happens. I
Mhm.
started playing around with this 20 years ago, and I can tell even in the last 5 years that my clients' nervous systems are very different, and
Mhm.
their level of tolerance and uh, the amount of input that can be useful in any particular moment is different, even with people that I've been working with for a long period of time. Does that
Mhm.
make sense?
Yeah. Do you contribute that to kind of uh COVID, technology? What do you feel like are some of the driving factors in
Probably see all of the above. The technology is indeed a significant factor, complicated by COVID, which put us in a place of isolation and a distancing that that kind of exaggerated the isolation that one might be feeling by the pace of the world and chaos that's going on. But yeah, so I think both of those are factors, and are, there's lots of studies that show how the nervous system has significantly changed for the average individual based on the kind of dopamine response that we're driven to have on a regular basis, whether it be looking at our handhelds on a regular basis and getting that kind of immediate feedback about things, and our tolerance around pace and process has been affected significantly, and that changes our wiring.
Mhm. Do you feel like
So yes, both of those. After not seeing some of my clients for an extended period of time during COVID, having them walk back in, I could tell a significant difference. I'm like, you've been holding your breath for a long period of time, I would say in my head.
Mhm.
And as I started talking and listening, it was the people were impacted significantly and stressed. And so yeah, COVID did a lot, but I think the isolation as a sequela of events was very significant.
do you think you going at like a different pace yourself, so like more patience, more waiting, coming into relationship with the client, is that kind of got extended in space and time, like the amount that you have to put into just stillness or space?
Yes, that's nicely put. It's a significant focus of what I do now to calm my system even more than I thought I was.
Mhm.
I thought I was pretty receptive and available and sensitive, and I've got a counseling background, so I know how to listen and have had some professional training in that. And I thought I was pretty receptive to what was going on, and I needed to even be more spacious and allow more time
Mhm.
and have lowered expectations of outcomes,
Mhm.
right? We're gonna take this slower. I would have to remind myself, because even though I may have an idea, I'm bringing this system along that's altered.
Mhm.
Yeah.
Yeah.
Yep.
Kind of speaking on terms of listening, going into a bit more of like a tactile sense, do you have any senses, and has it changed when you're touching or connecting with a nerve or a part of vasculature that's different from other tissues of the body?
So I think the structural integration series, as defined, has a layered approach to it. And while I believe I was following that layering in terms of working superficial fascia first, opening up the container, I was going right through with my enthusiasm past a whole rich area of the body, which included the skin layer. So the nerves come out from the spine through the musculature and weave in and out of the musculature and pop out into the skin level. And they have the highest concentration of nerve endings as they go through each of the layers. There's a higher concentration. So the skin is rich with sensory input. And this is a functional thing, so we know what our environment is like, right? Is it safe out here? Is it cold? Is it hot? Is the pressure something that I should be concerned with? And there's ways of speaking to the nervous system through contact with the skin. The skin happens to have a high concentration, probably the highest in the body, of Ruffini stretch receptors. And Ruffinis read shearing forces of long duration. And they send non-threatening signals or non-nociceptive signals to the brain. So we can do a lot to help settle the nervous system down by slowing down, being attentive to the mobility at the skin level, and going into a direction of ease. And all of these processes take more listening than doing, right? So we have to slow down and put input in and wait for a response. And this also, from the Hellerwerk standpoint, the elements of dialogue and engaging with the individual become primary when we are asking, does this direction of contact and pace feel different than this one, or preferred, or where is their ease, where is their pleasure, right? Where is that person receiving that, or how is that person receiving that becomes primary. So the skin mobilization piece I learned both from Baral and from Diane Jacobs. Diane is a PT from Saskatchewan whose primary, one of her biggest gifts to the world is a body of work called dermo-neural modulation. So dermo is skin, neural, nerve, and modulation is change. And she does mobilization at a joint level from the skin. She does mobilization of nervous system and settling and getting range of motion primarily from the skin. And this is profound, and was, another layer that I found later after the initial foray with Baral into how to invite change. Yeah. So if the skin is not mobile, those nerves are sending signals to the brain that the world is not particularly safe in that particular area or in general. And if you can invite non-threatening or non-nociceptive input to the brain and flood that, you get a change in the nervous system, and you'll get a tone change in the associated skin to muscle. The muscle connection in that nerve pathway goes and comes out of a spinal segment. You can get a change in the spinal segment's mobility and sense of safety. And then it sends it out ventrally to the organs. And there's a wonderful, yummy feedback that the inside is okay as well. So this is called Hilton's law. So if there's restriction at the skin level, there'll be an associated muscle contraction. There'll be a limitation at the joint level, and then the ventral feedback into the viscera from body to organ and organ back will be affected. So we can make change significantly through that whole pathway, which is something that we've all known kind of inherently by and intuitively by the work that we do by working with layers. But this fleshed it out even more, that we don't want to ignore the skin. So, yeah.
When you place your hands on someone or before, how do you listen? Do you hear pathways? Do you see pictures? Do you get guidance? Do you kind of follow anatomical knowledge? What do you listen to in yourself when you
Nice. So it starts by listening to the individual and hearing them report what's working and what's not in their body. So I like to hear both of those things. I do some assessment in terms of walking, but and other movements, but that's mostly for them to get a baseline. Once I get them on the table, I do range of motion pieces and bring their attention to those. It may be at a gross level, like the hip rotation, internal and external rotation. And then I'll go to kind of intuitively, I'm drawn to an area because it's not moving as well. And I bring their attention to that. And then I'll go and put my hands on and look for skin mobility. So I'm looking for, will the tissue move in, what directions does it move with ease? And then from there, that is similar to what I would do prior to this level of work. It's the same, I'm drawn to an area because it's not moving. I'm drawn to an area because it's tight. I'm drawn to an area because they told me about it, because I'm so sensitive to even listen to those obvious things. But that is the kind of the background. And then once I go, I ask the question, because of my experience and intuition, is this being held by a particular structure or relationship? Is this something that they've been told by their doctor? I've got clients that come in with hip issues. They say, oh, your hip is horrible. You need to get a hip replacement. So they're going to be hesitant to move because of that story. So do I need to address it? Is it on the story end? Or is it some combination of that, which it usually is? And is it being held by the body's protective mechanisms around the hierarchy of importance? So from an osteopathic standpoint, their kind of bumper sticker for this is the rule of the artery reigns supreme. So if the wrappings around the artery are not mobile, the artery may be giving feedback to the body that there's something that's not safe in that area, which the body will respond by contracting and protecting. And it protects things in an order: blood vessels, nerves, and viscera wrappings are more important than myo wrappings. Muscle is, and movement is really quite secondary or fourth tier down when you talk about blood vessels and nerves. If you don't have blood flow, you're dead. Mm-hmm. And if you don't have nervous signals, it's hard to move to be able to make sense out of your world and bring food in and sustain yourself. And then the organs are necessary for the fuel, right? So I'll look at those layering first. Is the blood vessels and nerves live right close to each other? Anywhere there's a nerve, there's a blood vessel within 5 cell widths. Wow. So they're in the same wrappings. They have individual wrappings, and then they have a wrapping around them. And that needs to be able to slide in relationship to the structures next to it, right? And if that's being pulled on, the body's going to protect that. Yeah. So we'll look at an area that's not moving, draws my attention to it. Then I ask, at which level is there an organ related to this? Is there a blood vessel and a nerve? And they're often in proximity to each other. Mm-hmm. So then, and oftentimes those do not take very long to address. And then what may be left may be more related directly to the body's response around a repetitive motion or a sequencing of firing or something, a protective mechanism at the muscle level. Mm-hmm. So,
why do you think it's quick to be addressed?
Partially by my experience and partially from the studies that Diane Jacobs has done. Very often the Ruffinis read long duration stretch at an oblique angle or a shearing. And the Ruffinis start to kick in and pay attention at about 30 seconds to a minute and a half or 2 minutes. So that's one thing. So the shearing motion, that's fairly quick and you'll get a response of safety. Body gets flooded with, okay, this area is safe, and which is an input or an afferent signal. The cerebellum gets flooded, the body processes, it's okay. We don't have to protect there. It'll send out a descending modulation and change the tone there. The same thing happens with visceral fascia. And similar approaches is more of an indirect. You take it into the direction of ease. The body then gets flooded with a lack of protective response, right? This is okay here.
Mhm.
And then you can, after close to a minute to 2 minutes, you get an invitation by the body by a change in the tone locally, or subtle cues like the person will start nodding off, or
Yeah.
their eyes drop back in their head, or they take a big breath. I look for those subtle cues. And you say, is this okay to move now, both with your touch, and you may ask the client if you're not calibrated to their response. And so there's the pacing of it allows for the body to respond. And when it finds safety, there's a tone change. And that generally happens fairly quickly. And the body's response to protecting that can involve a number of different dynamics in terms of musculature. So the myofascia then will be able to present what is actually happening within that a little bit clearer than the protective mechanisms.
Do you find that, or when do you find, if there is a time when the body is asking to not go into ease? Is there, or to get interrupted, or to get taken
If
out
I'm
of
not,
something?
yeah, if I'm not clear, I'll ask.
Uh-huh.
And I ask both expecting an intuitive response, right? I'll ask in my head, is this okay? And then wait for the response. Or I'll just say, I'm going to check range of motion here. Can you let me know if there's one direction that you would prefer, or feels easier, or feels more pleasurable? Depending on my rapport with them, I can use different words. But yeah, so it's a little of both. Sometimes what I think is the right direction might not be what they prefer.
Mm-hmm.
And then sometimes I have to ask why. If no pain, no gain is the battle, or is the battle charge or whatever of an individual,
Mm-hmm.
that might not be the direction that I want to go, but they might say it, right?
Yeah.
So yeah, that might be a moment of education or something. Yeah.
Do you ever find like with the client, when they're saying one thing, you're getting a different read, and maybe another part of the body says, I don't like this, but this part of the body says, I do like this. What do you kind of just went into it, but what do you do in that situation when there's a multi disagreement?
Right. So I have a number of directions as I'm coming to the fork in the road here. And I might say, hey, I know that this may be more useful or feel better if we went direct right now. But if you'll give me, if you'd be willing to play along, how about if we do a couple of minutes and see if we can get this area settled down, and then we can do something more direct. And it's probably going to be easier on both of us. Or something like that. That's not an uncommon default. And they'll, very often will say, when I go back and do something more direct, that I'm not pushing as hard as I was before.
Yeah.
Oh, you're not pushing as hard. Well, okay. Well, I'm glad it doesn't feel it that way. And
Yeah.
but something happened. So
Yeah.
some people, you need to alter the volume in
Mm.
terms of there's levels of expectation around what the work should be.
Mhm.
And also they need to pay attention. So the subtler approaches don't necessarily result in satisfaction for some folks,
Mhm.
right? They may notice a change, but we may need to up the volume a bit. And then I'll do something more direct, or I get them to participate in a way that they can meet me,
Mhm.
either through breath or movement or whatever.
Mhm. So since you started this work, what have you noticed in changes in yourself?
Um, I am more patient and more at ease with allowing as opposed to doing,
Mhm.
right? So it's kind of a back and forth play there, where you try, to quote my friend Ray McCall, we go back and forth between do and be,
Yeah.
right? Which is a cool jazz thing, doobie doobie or whatever, but it also is is part of what we do, right? Or what, you know, the process involves, I'm going to do something and then I need to be and listen. So I find myself more at ease with going back and forth between that and listening for response and feeling less interested or compelled or focused on an outcome and more on the individual moments, if that makes sense.
Yeah, it's soothing to my nervous system.
Well, good. Good. I was given a T-shirt at one class that I taught that it says I get on people's nerves, which I thought was rather clever, and I do wear it around the house a lot. My wife appreciates it. So
Yeah. Well,
but anyway,
the artery rules bumper sticker.
yes, next to that. So, you know, I do always, kind of back to a part of your question that I didn't respond to. I am very visual, so I love bombarding myself with repeated images through Google searches and things, and I thrive on that. It gives me an image. So I do think anatomy as I'm working, but that's not the drive. That's kind of the backdrop. Like you have a real clear backdrop behind your body. My backdrop is I see these images and then I feel them.
Yeah.
So it gives me a better sense of the three-dimensional quality of how a nerve that comes out in the front of the body goes through the ribs and relates to a certain vertebral segment in the back, and that also relates to the organs in the inside. And so I get that picture and then I feel it.
Yeah.
So it's back and forth. It's not one or the other. But yeah,
Do you have
it's a fun dance.
Do you have a favorite anatomical artist or book that you just love for the visual?
Boy, there's so many out there. I love the Clementi and Netter as kind of classic ones. And boy, I'm drawing a blank. The artist that Baral uses in his books is exquisite, and I think they require their instructors to be able to draw, which I couldn't teach for them because I can't draw very well. But I do appreciate those three. And there's a number of other. Diane Jacobs' book has a number of really nice renderings and of different nerves and the layering and things. And I do default to Google Images search because there's lots of stuff to harvest off of there.
Yeah.
And I'll check one day and look for, you know, dorsal ganglion or something, and an image will come up and it'd be real cool. Then I'll search the next day and there's a whole nother thing that pops up on the search engine. It's like, I don't know who's affecting my search engine or putting more source material out there, but I appreciate those. Yeah.
Yeah. Well, to kind of wrap things up, I'd just love to know, what are you really curious about? What are you interested in learning more? What's kind of got you really passionate at this very moment?
How to reestablish a sense of safety for myself. I've done a bunch of things with breathing and study with a bunch of different characters along those lines, and polyvagal theory from Stephen Porges. I've got a number of his contributors that I'm working with. I'm looking forward to doing some work with Amber Gray, who was versed in not only body work and ecstatic dance, and she's got a background with continuum work. In addition to, she's a PhD and has a whole body of work for working with the body as systems and helping nervous system regulation. So I guess in a nutshell, it's nervous system regulation, not only for my own survival in this chaotic world, but I'm seeing it coming in more with my clients. So how do we work with vascular and neural tissue as it relates to the lungs, as it relates to anxiety and things that people are experiencing that may have underpinnings in lack of ability for the lung to be compliant and adaptive. So I'm
Mhm.
working a bunch with different types of approaches to relieve the strains from long COVID, in
Mm,
addition to the kind of compressive forces of fast-paced world that's uncertain. So yeah,
beautiful.
lots of different things to play around with, and no lack of things other than my lifetime in terms of the studies. So yeah.
And you've got a class coming up here
I
in
do.
June.
I had taken some time off of teaching, and I'm getting back on the road a bit this year. I've got a class coming up in Boston. I think it's June 6th through 9th. It's the introduction to the neurovascular work, focusing on shoulder girdle and pelvic girdle. And then I'm doing the same 4-day class over 2 weekends in Boulder in May. And I've got a class on, it looks like some sort of integrative self-care for the nervous system that we're going to do in Lawrence, Kansas. And it looks like it may be over Memorial Day weekend with Amber Gray.
Oh,
So
lovely.
yeah, so I'll try to put that out there into the whatever internet somewhere. And I appreciate your supporting this venture, and including these offerings in the Hellerwork group. So do appreciate you all.
Oh, thank you. We are so glad to have you here with us in the Hellerland, as I'm calling it.
The Hellerland, very good.
Well, this is lovely. I had just learned so much. I just had a nice conversation, which is what I love about what I do. So I appreciate you
Excellent.
taking the time.
Well, I appreciate you. Thank you.